Clinicians have now officially cut ties with the Kenya National Union of Nurses. The paramedics have signed a recognition agreement allowing them to sit on a negotiation table with the Ministry of Health over their remuneration and working conditions.
Today was a milestone again for the clinical officer because we have been able to now fully sign a recognition agreement with the Ministry of Health on behalf of the national government. And now we have at least a frame on how we need to be engaging each other.
In recognition that the union is going to represent the employees and the employer in all matters pertaining to the terms and conditions of work.
As a sign of good faith, the Kenya Union of Clinical Officers downplayed claims that were circulating of a purported industrial action to join the striking nurses, but added that it was skeptic of the commitments of the Ministry of Health to implement agreed parameters.
This was the fifth time we are coming here to sign the document, but for the first, second, third, we failed to sign the document because of some of the officers were not available. We said if this one was not to take force, then we will have no option. Now, because already they have now signed the document, we don't have any notice for the Ministry of Health as per now.
The clinicians had earlier this month threatened to mobilize their members to go on strike, accusing the government of frustrating negotiations on their collective bargaining agreement. They were demanding risk and emergency call allowances to be raised from 3,000 and 10,000 shillings to 30,000 shillings and 70,000 shillings respectively. They also wanted health workers' allowances increased from 20,000 shillings to 30,000 shillings and employment of an additional 4,700 officers to cater for universal healthcare program. Purity Museo, Channel 1 News.